Good morning, everybody, and welcome to County Executive Stuart Pittman's regular weekly press conference. I'm Roz Hamlet. I'm the County Executive's PIO, and I'll be moderating the media briefing. Thanks for joining us on Facebook as well. This morning we'll begin with County Executive Stuart Pittman, to be followed by a report from Dr. Nilesh Kalyanaraman, and we have a special report from Mr. Kirkland Murray from Arundel Workforce Development Corporation, who's going to let us know a little bit about a plan that the board just released. With that, let's get started. Mr. County Executive.
All right, thanks, Ross. So the numbers are continuing to look good. Yesterday was a good day with only 43 new cases, bringing our case rate down to 16.4. Hospitalizations are remaining well under 100, with 87 COVID patients in our two hospitals now. And while we mourned the death of 500 people yesterday, we're at 500. Last week we're at 511. Expect those numbers to start declining more as the recent case rates and hospitalizations decline. Vaccination, we got 3,400 doses to the health department this week, and we do want to thank the state for giving us advance notice. They have been getting a consistent number from the feds and are now letting us know that at least for the next few weeks, our health department will be at the same level. Unfortunately, Anne Arundel Medical Center, that was getting more in the past, got up to 5,000 one week, is down to 100, and Baltimore Washington Medical Center not getting any allocated. We don't have data for, the state does not release data yet for the pharmacies. Giant, Safeway, and Walgreens are the three that we know have locations in our county that are advertising that they're doing vaccines. And we don't have data for how many doses are being administered at Six Flags, just a few miles from our county border, Baltimore Convention Center, or as of this Thursday, we'll have the M&T Bank Stadium up in Baltimore as well as state mass vaccination sites. So we're eagerly awaiting data on how many each of these locations have, so people will know when they're vaccine surfing, where they're most likely to have success and put their time in. Pre-registered in the county on our aacounty.org/COVIDVac site. We still have a lot of people waiting. Within 1A, we still have over 5,000. And then within 1B, 33,620, of whom almost 16,000 are still seniors 75 and over. There are people that are on those lists still who may have been vaccinated elsewhere, and we're encouraging them to please go to aacounty.org/COVIDVacs and unsubscribe if you have been vaccinated somewhere else, so that we don't contact you when appointments are available. Of the doses that our health department is administering, I do want to continue to commend them and our Department of Aging and Office of Emergency Management and my staff at Constituent Services, because with the snow recanceling and with the second dose fiasco that we had recently with those not arriving on time, there's been a lot of extra work on the telephone contacting people about rescheduling appointments, and the amount of basic customer service that has been required is high, and it's really important that they do that, particularly with people who are not internet savvy and don't always check their email, particularly those folks 75 and over. Very, very important that we provide that help to get them vaccinated. Our teachers at Arundel County Public Schools, who are all under one employer, had their first vaccination day up at Severna Park High School. It went very well, and run by the fire department. Logistics were excellent, and the spirit was excellent as well from people who were there. There will be more of that this week, and we are continuing to vaccinate our private school and our child care educators as well. They get vaccinated through aacounty.org/COVIDVacs at the casino, live casino, and Anne Arundel Community College sites, and they actually are having separate vaccination clinic times. where it's those educators coming. So they schedule specific times for those folks. We've had plans in place to expand our county vaccination programs with mass vaccination sites, Navy Stadium, Jennifer Road, Bayview, and those are, of course, on hold until we have enough vaccines coming to be able to justify these large sites. As far as the state and the Maryland Department of Health go, I think back on last week, or on the 8th, last Monday, 22 counties, the Maryland Association of Counties sent a letter to the state, to the governor, with some very specific asks. And one of those we have been granted, which is that we are getting the advanced notifications so that our local health departments can plan. We're pushing hard for dose allocation from these other sites to have that transparent. And we've not gotten a yes, although we were pleased to see that on social media, the state put charts, pie charts for 4 Maryland counties showing how many doses they were getting through pharmacies, through the state sites, through hospitals, and through the local health departments. We've asked the governor's office for that for Anne Arundel County, hoping to receive that soon, and hoping to be able to look across the state at how many doses are going to each county. We're told that it's done by population, but we believe that we're not getting as many as we should. And we're working on that to try to get more for our residents, regardless of the provider. The strategies vary by county. You could see from those 4 counties, Montgomery County, almost 50% was through hospitals. Anne Arundel County, there was a period where it looked like the state was heading in that direction when Anne Arundel Medical Center had a large number of doses, but they seem to have moved away from that. And I just want to say that we are flexible. I mean, my goal is to get our residents vaccinated by whatever provider is willing and close enough for people to be able to go to. We would like to have a central system. We'd like to have people come through us, if not through us, through the state, so they don't have to go to all these different sites. You may have seen our weekly report we put out on Saturday. Once we had our allocation numbers, we have every site that people can go to be able to get vaccinations. And it's just a lot of work. And it really, the people who get vaccinated are the ones who are better on the internet. I was told by a teacher recently that she has all the sites up on her screen and she just keeps them opening and resetting, hoping that some provider will have doses, and ended up getting vaccinated just this weekend in Waldorf because this teacher was nervous about going back to school without being vaccinated. But we don't like to think that the people who are the best at surfing the internet are going to be the ones that get vaccinated and the others are not. The Maryland Department of Aging, we were very pleased to get an email from on Saturday to our Department of Aging requesting 2,000 names of seniors so that they could put them in line to get vaccinated at Six Flags. So we got them that list on Sunday, and we'll be notifying those folks that they may be contacted by the state, and we'll be monitoring that, hoping that those folks get vaccinated at Six Flags. And we're looking forward to the opening of the M&T Bank Stadium site on Thursday. So we will aggressively work with all of the providers to try to get people from our list, people who we know are selected based on our health criteria and our equity lens, vaccinated as quickly as possible. So I just want to say on COVID and on vaccination, please continue to distance and wear masks. We're not through this by any means. Please monitor your email and get tested when you can. If you've registered, you will get notified by email. And some people are not opening their email. And please, 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 when you finally do get vaccinated, unsubscribe from all of the lists that you're on. It makes it much more efficient for everybody. Tonight, we are doing our Tuesday night with the county executive, and it's going to be really a town hall on vaccination strategy with Dr. Kalyana Raman, Tony Gedden from the health department, who's really the logistics general for all of this, and Carissa Gowan from our Department of Aging, taking questions, hearing people's ideas on how we can do this better. That will be live streamed at 6 p.m. on the County Executive Facebook page, as well as broadcast on WNAV Live. Economic Development Corporation is launching, I think there was a press release about this last week notifying folks that this coming Friday, they're opening the portal for hotels, inns, and bed and breakfasts to be able to get the $5 million in assistance that's being provided to them. The businesses have to have shown that they've experienced a 25% loss in revenue between April and November of 2020. Not difficult to prove if you're in that industry, unfortunately. So we're looking forward to getting that money out as quickly as possible. OEM, Office of Emergency Management, is monitoring some possible weather storm threats coming this week, and our warming centers will remain open at our police headquarters. Please beware, our COVID-19 information line has gotten a number of notices from people who believe that there are scam calls about vaccination sites. Please make sure that whoever's you're talking to is a government, county, or state site. Pharmacies are not calling people asking them to get vaccinated. And then Department of Aging and Disabilities, I just want to thank them. They have done 399,000 plus meals to older adults during this time, 7,700 just last week. And Fresh Food Friday, if you haven't been, it's amazing seeing the wonderful vegetables and fruit and fresh food that's being given out in boxes, 15,000 boxes to date. And then the new COVID Care Coordination Program, where we actually contact people, families who've got members who've tested positive to help them with any services that they need while they're quarantining and staying out of work, has in its first 90 days helped 200 families who have a person COVID positive. So I will end with that, thanking, as always, all of our staff, all the departments of county government, and everybody out there for doing everything that you're doing to push these numbers down and get us through this pandemic. Thank you.
Thanks very much. Dr. Nilesh?
Thank you, Roz. Thank you, County Executive. I think County Executive covered pretty well a lot of the current landscape. I just want to offer a few additional points. In terms of our case rate, it is down to 16. We are seeing less testing, but our percent positivity is staying at around 6%, so that's good. Urge people to continue to take advantage of testing if you feel like you've been exposed. It's still there and available for you. Our hospital census is staying stable in the 80s to low 90s, and that's we'd like to see it continue to go down, but it is, I think, right now where we need it to be. And we saw fewer deaths last week. At 9, we know that number will go up. It usually does as the official death certificates come in. In terms of vaccination in the county, we've had 57,000 people get their first dose, so just short of 10% of the population, and another 24,000 with both doses, so that's 4.2% of the population. So we've got about 14.2% of the population who's had at least a dose. The health department, we've done 25,000 first doses and 12,000 people with both doses. As the county executive noted, it's really helpful to get that 4-week projection. It means that we can put into place some of the changes that we were looking at doing in order to get better penetration into the community. Right now, we're in phase 1B. We've still got tens of thousands of people registered in 1B, and we're working with the ARC to get those with intellectual and developmental disabilities who were just added to that 1B category to get them vaccinated as well. We talked about equity being critical as part of this. We've made some additional outreach, and we've seen some increases in the pre-registrations amongst Blacks, Hispanics, Asians. It's small, but it's an improvement. And also importantly, we adjusted how we are giving out appointment invites to just ensure that we're not underrepresenting minorities. and we saw an increase from 5.6 to 6.8% of the people vaccinated being Black, and in Hispanics, a smaller increase from 1.3% to 1.6%. So there's a lot of work to do there. And that's part of why we are looking at expanding its community sites to make it easier for people. Looking to be at a couple of additional sites next week, one in South County and one over in West County. Our mobile program went to senior low-income housing last week, Hammerly House and Victoria House, and we've got another couple of sites this week that we're going to, Glen Forest and Gardens of Annapolis, and we'll continue going to these sites at least a couple a week, as long as the sites need to get vaccinated. And I think that's the big thing that we're seeing is the equity in this. County Executive mentioned that being able to web surf is a key part of this process. And I think it's on us to make sure that while that is a way to get vaccinated, that can't be the only way to get vaccinated. And so we will be increasing our outreach to minority groups and to areas of the county that have lower vaccination rates. With that, I will turn it back over to you, Roz.
Thanks very much. Mr. Murray.
Good morning, everyone. Kirkland Murray with Anne Arundel Workforce Development Corporation. I'm pleased to announce that the Anne Arundel County Local Workforce Board has released its Workforce Development Plan. This is a 4-year plan to talk about how the workforce development system is going to meet the workforce needs of Anne Arundel County. It aligns all the partners in the workforce development system. The partners are made up of Anne Arundel Workforce Development Corporation, state agencies, county agencies, businesses, economic development, the public school system, Anne Arundel Community College, and community faith-based organizations. So this plan really lays out a strategy, a vision. And the board's vision is that we have a high-performing workforce development system that is robust, seamless, and equitable so that Anne Arundel County businesses have a pipeline of skilled workers, and all Anne Arundel County residents are connected to family-sustained employment. This plan is a roadmap to how we're going to reach those goals. And it really focuses on 5 main points. One is the impact of COVID and how do we recover to make sure that Anne Arundel County recovers strongly from COVID-19. Increase equity in the workforce system so all residents have access and services to achieve family-sustained wages. 3 is that it's demand-driven approach to services which prepares individuals to succeed in the current job market and meet business demand. Then also we want to increase youth and young adult services to better prepare them for a future workforce. And then we also want to make sure that individuals have, we take a individual-centric approach which meets individual residents where they are and provide comprehensive services based on individual needs. So right now the plan is out for a 30-day public comment period. The comment period will end on Friday, March the 12th. And to view this plan and provide comments, you can go to our website at www.aawdc.org/local plan to review this plan and provide comments. That's all.
Thank you very much.
So
before we take our first question, I'd just like to remind everybody that Dr. Nilesh has a hard stop at 11:30. I have a few questions coming into the chat now. Let's begin with the Capitol and Danielle. Oh.
Hey, good morning. Thanks so much, Roz. Quick question for either the county executive or the county health officer. You've discussed a lot this morning the issues of equity, and I'm wondering, other than kind of those community sites that you're trying to do and reach specific populations, how is the county addressing those folks that don't have internet access and, kind of don't even know, the numbers to call because they can't look them up on the computer?
So there's a couple of items. One is that we do both pre-register and schedule for appointments for those who are eligible for via phone, and that's our COVID health line. And we've done between OEM, aging, and health, we've done 54,000 calls in the past month. So that's absolutely there, and we're pushing that phone number out so people know that they can call that. Obviously, if people don't know about it, they can't call. And so that's why that's a key part of our messaging this week, is for people to utilize that number who don't have internet access. And then transportation is another piece. And we'll work with our Department of Transportation to help get people rides who need it.
And when you say you're pushing out that number on the internet, or
no, through other channels. So looking to hand it out where we do food, our food sites,
gotcha.
Other communications channels, social media. People get information a lot. They may not be able to use the website to pre-register, right? That's a little bit more of an active engagement, but they get it from a variety of sites.
Gotcha. And quick second question. County executive, I think I heard you mention that BWMC got 0 vaccines this week and AAMC got 100. Do you have any sense of why that is, and whether or not the state health secretary is going to be kind of giving a presentation on Anne Arundel's vaccine allocation like he did with 4 other counties?
Well, we've contacted their office this morning requesting that Anne Arundel's numbers be provided, and MACO is requesting it for every county, of course. But no, I mean, it was curious that there was a week when Anne Arundel Medical Center jumped from under 1,000 to 5,000 doses allocated to them by the state, and then dropped back down and has now dropped lower. So while Montgomery County hospitals are getting a lot of doses, we don't know what the strategy is, and we haven't heard from the hospitals what it is. It's a real concern for them because they have inpatients that they want to vaccinate. And I believe that we've provided some doses to them at this point to do that, not in large numbers, but that's absolutely essential. So we can't answer that question.
Thank you.
About why.
Right.
Next, let's go to Mr. Lowell Melser, WBAL-TV.
The muting. Okay. Good morning. This is to whoever can ask it. Just had a quick question concerning vaccine distribution on Thursday. There's the potential for a major winter event, and some health departments are switching their vaccine appointments that were scheduled for Thursday to either Wednesday or Friday. And I was curious if Anne Arundel County has any plan in place to switch things up if it becomes a weather event for people, making it difficult for them to get shots on Thursday.
So we are actively tracking that. Unfortunately, won't be the first weather event we've had that disrupted our vaccination plans. So we don't have any intention to change it right now, but as forecasts change, we may change that.
Okay, thank you.
I'm sorry. Let's go to Kate O'Mara, please, with BAL-TV.
Hi, thanks, Ron. My question is for Dr. K and the county executive. You said that you're working and fighting to get more transparency from the state on the vaccine allocation to retail pharmacies, for example, in Anne Arundel County. So if you don't have that, how are you able to produce statistics on the number of residents that were actually vaccinated? And part 2 of that is the state says they get, for example, the 4 counties that they put those pie charts out for, they say the retail pharmacies in those jurisdictions are getting doses. But does the state guarantee that those doses given to retail pharmacies will go into the arms of people in those counties? I'm just trying to figure out how the allocation and the numbers of your residents vaccinated, how that all shakes out.
So I can answer the first question. We're able to tell who's gotten vaccinated based on the state. So everybody who gets vaccinated, their information is put into the state system called Immunet. So we're able to pull that out. It doesn't tell us who did the vaccination. So that's why we can't tell what the allocations are, but we can tell how many people have been vaccinated. You'll forgive me, I don't remember the other question.
Well, on the second one, it's true that just because a provider is in your county doesn't mean that they're providing vaccinations to county residents. And we know that our residents are going elsewhere, and the pharmacies in particular are not restricting by county. So, but what we're asking for is to know what sources have vaccines and how many in our county. So how many are available to anybody within our county borders. And of the pharmacies, we know that we have Giant has 2 locations, Safeway 6 and Walgreens 10 that we're telling people about that that seem to have doses, but you go to their websites and you wait until they say there's something available. They don't let you in to actually register until there's something available. So it's very difficult to know how many are being done, but they know because they're telling the state. How the state's telling them how many they've got, and we hear rumors from time we hear them talk about how many doses they're doing per location, but we don't have any comprehensive data, and we really think that that's important to have.
And so I just want to clarify. So eventually, the vaccines that are distributed and the numbers that go into Immunet, it trickles down to Immunet eventually. So those numbers, does it lag a few days? How does that work? And does it affect how you tweak the algorithms for selecting people from the waiting list, the more people that in the county that get vaccinated?
So I'm not sure of the exact timing of the delay. It's not, I can find that out, but I think it's probably something on the order of a day at most. But in terms of our algorithms to share appointments, because the information is fairly up to date, and we're not changing appointments day to day. We send out appointments typically once a week. Sometimes we'll add more as more doses become available. So it's really, we're looking over the past week or few weeks to make those decisions.
Thank you. Let's go next to Channel 45, Fox 45, and Joseph Ojo.
For Mr. County Executive, I just wanted to find out, are you satisfied with the plan to return to schools, and are you satisfied with the efforts in place right now to get teachers vaccinated?
Well, I'm not satisfied with the pace of getting teachers vaccinated. I would love to get every single one of them vaccinated before they go back. And we don't have enough doses to accomplish that. And so we are trying, and that's why we're encouraging them to go anywhere they can to get vaccinated as well. The school board's made a decision. The research is showing that spread in schools is not higher than spread in community if all of the protections are in place that the CDC recommends. And I believe that our school district has put those protections in place, and our health officer has approved it. So it's unfortunate that, and I completely understand the anxiety that teachers have, particularly going into a high school where kids might be 17, 18 years old, and there is a real chance that they're out there getting infected and spreading, and it's scary. But we've got to get the schools open, and we're going to get them vaccinated, if not by the time they get back, very soon after they get back. And it's just impossible to have an accurate projection of when that will be, based on the numbers of doses that are coming in, based on how many teachers get vaccinated elsewhere, based on how many teachers want to get vaccinated. So we are hustling and trying to get them all done.
And one last question, just want to kind of get just some little background knowledge on the reasoning kind of behind why public school teachers are, maybe getting that higher share of the vaccines over private school teachers there. Is there a reason for that? Do you know?
They're not getting a higher share. I mean, Dr. Kalyanaraman got the data on the populations. It's about 2 to 1, twice as many in public schools as private and higher ed. And that's the way we've allocated our doses, is 2 to 1. So for the two groups.
Thank you.
They're just going to a different location for efficiency's sake, under one employer, one vaccinator.
Thank you.
Okay, are there any further questions? Hearing none, thank you very much, everybody. We're all in this together.